Welcome back to a segment that could save a life, yours or someone you love. February is American Heart Month, and this morning what we're going to do is learn exactly what you need to do if it looks like someone in your vicinity isn't breathing or their heart has stopped. And we called in the experts to help us. We've got Dr. Jon LaPook, CBS's chief medical correspondent. You know him well. And we brought in another expert. Dr. Deepak Pradhan is a critical care specialist at NYU Langone. And this, do we have a name for our dummy helper here? No?
Nameless.
Nameless? She'll remain nameless for now. Let's begin with the key question, which is, how do you know that somebody's actually in cardiac arrest?
It's a great question because people are afraid. Somebody went down. How do I know they didn't just faint? So Dr. Pradhan is going to take us through the beginning of that.
So start with the basics. See if they're responsive. Get down and say, sir, can you hear me? Sir. And then shake their shoulders gently. There's no response. And then go ahead, shout one more time. Sir, can you respond? Sir, can you respond? Patient is unresponsive. Tony, call 911. We need emergency help now. Dr. LaPook, grab the AED, bring it back right away. Next.
This is the AED.
Right, and we're going to pretend that it's not here because it's generally not right with it.
And by the way, great instincts in sending me to dial a phone. I can do that part.
Okay.
Yeah.
Great. So next, I just want to see if they have a pulse. So I'm going to put my two fingers into their neck and feel for a pulse. I'm also looking at their chest to see if it's rising and falling with breathing. I do this for about 5 to 10 seconds. No, the patient is unresponsive. There is no pulse. There's no evidence of breathing. So this is all consistent with cardiac arrest.
Okay.
So now I'm going to start hands-only CPR. So bystander CPR. So you're going to take the heel of your one hand, put it right in the center of the chest, right between the nipples. You're going to take your other hand, put it right over top. Rock yourself forward so that your shoulders are over top of your hands. And then you are going to start, lock your elbows and then start pumping hard and fast, 100 to 120 times per minute.
Wow. Wow.
And
that's serious pressure.
Yeah, and it's to the tune of staying alive, staying alive. All right? Okay? All right, now this is happening. All right, now let's say the AED has now arrived. Okay, we're going to put it over here. And Tony, you have never used an AED.
No.
Never had any instruction, right?
Never.
I am going to give you one piece of advice after you open it.
Okay.
All you have to do is hit the on-off button, and it will talk you through the whole thing.
Okay. I'm hitting it.
Go for it.
Remove clothes from patient's chest.
Yes, the pads need to be directly on the skin.
When patient's chest is bare, open gray plastic case and peel off white adhesive pads.
Go ahead. Great.
Look carefully at the pictures on the white adhesive pads.
Okay.
Peel one white pad from the gray case.
Now, the audience may not be able to
Place
see
pad
this.
Exactly as shown.
There's a picture of the chest,
there's a picture
and
of the chest.
exactly where to put it.
Firmly
It'll tell you where to put it.
skin.
Okay. Excuse me, doctor.
Yep.
All the way up here.
Good.
When
Perfect.
the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin.
Excellent.
Okay.
Stay clear of patient.
Everybody
Hands off.
Analyzing heart rhythm.
Now, people are worried they're going to. What if you shock somebody who doesn't need to be
Stay
shocked?
Right.
clear of patient.
It's programmed only to give a shock
Analyzing
if it's
heart
needed.
rhythm.
Which is what is happening now. It is.
Right.
It is.
It's analyzing.
Shock advised. Stay clear of patient. Press the flashing orange button now.
Go ahead.
Shock delivered.
Great. Resume CPR until the heart is going to
Be sure
restart.
emergency
The
medical
AED will
services
reanalyze in
at
2
all.
minutes.
It is safe to touch the patient.
Beautiful.
Begin
Wow. Now,
CPR.
he's getting
For
tired.
help with CPR, press the flashing blue button.
You're going to now do CPR.
Place the heel of
It's
one
going to
hand
tell you how
Great.
to do
So, Tony,
CPR.
you're going to do what I'm doing,
Yeah.
what it's saying to do. So we are going to switch in 3,
on top
2,
of the first.
1.
Push the chest down
Go ahead.
firmly
Good.
2
Perfect.
inches.
Now, the
Keep
reason.
time with the beat.
Excellent, because people go too fast sometimes to get excited. Now, what's so important here is this would not have given a shock if the person didn't need it. And once somebody goes down, for every minute of delay getting a pulse back, survival goes down 7 to 10%.
And give 2
So the
full
CPR
breaths.
will buy you time,
Right.
but you're ultimately going to be saved by the shock being delivered if the person has a shockable rhythm. So
That's the
CPR
patient there.
first, AED. This is exactly the kind of device that saved the life of Damar Hamlin. So let's turn this off. Tony, you have just zero instruction beforehand, right? No, zero. And you have potentially saved a life. So now, no.
Potentially. Dr. LaPook, thank you very much. Dr. Pradhan, you're very good at this. I want you around if this is ever me, okay?
Well, we need to make the point that people need to know where the AED machine is in their place.
And this is very doable. This is very doable. People should feel comfortable with this. If you see it, know where it is, know how to use it. It'll teach you how to use it.
Tony, there's 10,000 cardiac arrests in the workplace every year, and only about 50% of Americans know where their AED is located at work. And so we can do better.
Yeah, I have no idea.
Yeah, exactly.
And the last point I want to make is for people watching this, if you're in an office, go to your office manager and say, hey, where's the AED? Where's the course? And if you're home, what a great thing to have a party or a get-together at your home with friends, family, have a CPR AED course, and that includes one for infants and children and a first aid course for infants and children, too.
Wine is heart healthy as well. You can bring that to the party. Thank you both very much.